coming back as positive. They do travel. Sorry. Okay. So now, what is the good news for us? That for Punjab, the good news is that there is no environmental circulation this year. But this is very new. In last year, Lahore was repeatedly positive, and number of districts in Punjab were positive. And Gujarat has been positive last time in 2024, where we tested the sewage water and it came back positive, which means that no district, as I said, I'm repeating myself, but no district is risk free unless whole of the Pakistan and whole of Afghanistan is risk free. So there are still 5 sites out of 23 in Balochistan which are positive. KP, 4 out of 23 sites are positive. Sindh, 1 of 29 sites is positive. So there is some virus being detected somewhere in Pakistan, not immediately in our vicinity, but that virus can quickly come to our vicinity with any unimmunized child. So there are two vaccines that we use to combat polio. One is oral polio vaccine. This is the vaccine that they give as a part of vaccination schedule and also by the teams during national campaigns. So these are given as two drops and you don't need to inject them and you give to every child under 5 years during campaign. And in the vaccination schedule, there are specific weeks during which I'll show you when this vaccine is given. So this vaccine is great for every child. So this, how do I mean? Because it stops the circulation. The vaccine goes through the gut and vaccine is then excreted through feces, which means that the gut immunity is improved. IPV vaccine is very good for the child. It does not protect the other children. It is because it does not pass through the gut. Right? So these are the two vaccines. Both of the vaccines are part of the routine schedule. So the same drops are given during the routine vaccination of the child and same drops are then given by the polio teams. And basically this is the vaccination schedule and all of the vaccines are given free at all government health facilities. And some of these vaccinations such as polio and BCG, they are not even available at the private sector. And in the government, we have a very good system of cold chain where the vaccines are basically obtained and stored at the federal warehouse in NIH Islamabad, which is the FDI, Federal Directorate of Immunization. Then it goes to the provinces and then it goes to the district. And then at the district, it goes to the health facility. We have a cold room here at district. It is located at Fawara Chowk DHO office. And then we have ice line refrigerators at every health facility. And then even when the vaccinator is going to give the vaccine, they have specialized carriers, which are the standard vaccine carriers. So the whole process is very well equipped in the government sector. This is a common thing that the public does not know because public is getting this facility for free. But when they go to the private sector, there is no centralized chain. Private sector will be obtaining it from third party here and there. Private sector has no way to ensure that every step of the process is interconnected like in the government sector, right? So these are the vaccines that are given at birth. Oral polio drops are given. BCG, Hep B, 0 dose is given. Here the 0 means 0 dose. We call it 0 dose. And the BCG is given at the right shoulder, as you know. Then at 6 weeks, we give these 4 vaccines. Oral polio drops. Rota is also an oral vaccine for diarrhea. Then we give pentavalent vaccine against 5 diseases. And then we give pneumococcal vaccine against pneumococcal disease. So this is the schedule that every child follows from birth till 18 months. In other countries, you will see that oral polio they have replaced. For example, in Europe, they will be not be giving oral polio vaccine, but they will be giving 4 doses of IPV because they don't need gut immunity as much. They just need to protect every child. And every country in the world is giving polio vaccine just because of us. Once we stop polio, then no country will need this vaccine. Right? So next will be myths. There is a common myth, I will address it, that the vaccine causes infertility. In Pakistan, the polio program was launched in 94. In 98, we started door to door. Initially, we were doing booths. So there would be announced centers which parents would take the child. But now we have door to door vaccination. And after that, the Pakistan's population trends are increasing. So we have a good cohort of adults who have received this vaccine, who now have are contributing to the population as parents. And we cannot say that this vaccine causes infertility. This is proven through time. Sorry. And the next myth is that one dose. My child has received one dose. Now they don't need to be vaccinated during every campaign. Multiple doses are needed. There was a, if you need it, I will share it with you, but there was a research paper especially on South Asia, where we saw that our children repeatedly suffer from diarrhea. Our children have difficulty in access to clean water, and they, for them, even three doses only give partial immunity. So repeated doses are needed if you are in an endemic country or region. Polio is already gone because in Gujarat we don't have polio cases. We may think that it is already over, but there are still three cases and 100 samples during this year which are positive. So this means that the virus is there. Vaccination, some people do uh, believe that it is against their religious values, but this program is endorsed by the leading religious scholars and Islamic advisory bodies, and we do have those fatwas in case anybody needs the reference. So what can students and faculty do? You can correct misinformation on your end. You can tell people that all the vaccine that is procured in Pakistan is WHO pre-qualified. If you type into Google WHO pre-qualified, you can actually check that all the vaccine that we are using is pre-qualified, meaning it is safe, it is effective, it is vetted by WHO. You can encourage people for vaccination. You can report any child who has sudden weakness who is under 15 years of age. We don't take any by birth cases, but any case that you feel has any child that you notice has sudden weakness developing over few hours to few days, and the child is less than 15 years of age, you can report as acute flaccid paralysis or AFP. You can report it to us. I will share the contact details, or I will share with Dr. Akash. He can share with you. And then we have on and off vaccination campaigns. We had one campaign in Feb, one in April, and the next campaign is going to be in December. So we already have University of Gujarat's sociology department students volunteering or even doing paid activities for us for the campaign monitoring. So you can also be involved in the campaign by encouraging, and you can study it as well. It is one of the largest, the Pakistan's and polio program and the Pakistan's polio surveillance program is one of the most comprehensive programs in the world. So you can study it for your research purpose if you're interested. These are the references that we have used. And I thank you for your patience during this. And if you have any questions, you're most welcome.
Okay, students, if you have any question, you can ask. My first question would be एक चाइल्ड को अगर थोड़ा सा सम अप कर दें कि कौन कौन सी वैक्सीनेशन जो हैं किस पर्पस के लिए लगाई जा रही हैं इन Okay, I think I was not
You
audible.
are audible enough. I can answer this. If there are no questions, we can just answer this. Right. So, hum, Acha, there is also an other webinar. I will share it with Dr. Akash. It is basically leading polio experts. European Center for Disease Prevention and Control is having a webinar actually today. So I will share it. Anyone, if they want to know a little bit about the global perspective of polio can refer to this. And I'm just going to share with you what antigens and what vaccines are we protecting against through our routine vaccination. Just a sec. So I'm just sharing this. You can also share this, and this is a good resource to refer anyone. If you look at these are all the diseases against which we are giving the vaccines. BCG is given against this TB, Rota vaccine for diarrhea, and then we have Penta, which covers 1, 2, 3, 4, and 5 components. Then we have tetanus as also in PCV for pneumonia, oral and injectable for polio. Then we have typhoid vaccine for at 9 months, 1 dose for typhoid. And then with measles, we also give rubella. Rubella is a little bit milder form of this fever. So these are all the vaccines that we are giving in Pakistan. We are not, unfortunately, giving vaccine against chickenpox right now or mumps due to budgetary constraints, but we are protecting children against all of these diseases. These are 12 diseases. Any other question? There is, I think, a question in the chat. What are the major symptoms of polio? Okay, very good question. So for the polio, one of the main symptoms will be the viral prodrome. Initially, you will have just in any viral, just like flu-like symptoms. So you will have body aches, you will have muscle pains, you will have mild fever. Then you will have, in some cases, high spike of fever, and as that fever goes down, the child will develop weakness. The weakness could be initially in whole body, but then it will usually localize to one leg. That is the most classical polio. But polio can involve all 4 limbs. Polio can be single limb. Polio can involve your basically uh, your neck, part of your neck and throat. It can also be bulbar polio, which can make swallowing difficult. And in that case, we have very high rates of death as well. So, there is also an interesting video regarding this. I don't know how much time you have, but
We have just 5 minutes or so.
right. So you can look at this. So this is the last US polio patient who has just died few days ago, and she was living on an iron lung because she was unable to breathe by herself. So it is a very dated contraption that they were using. She spent her whole life since her childhood in this machine, in this iron lung. So you can see the impact in peripheral areas of Pakistan. We are not going to even have this facility. So the child who contracts polio in those regions is likely going to basically die. So this is why we need all children to be protected from polio. Any other questions, please? Um, Dr. Akash, I think there are no more questions because I don't see anything in the chat. So I'm really
I think
thankful.
there is, there is a last question from someone. How does the poliovirus physically attack the nervous system to cause the paralysis? I think this will be the
Okay,
last question. Then we will do the closing.
right. So this is again, I'm guessing this student is from health sciences or related. So poliovirus basically attacks the anterior horn cells, and that is how it causes the permanent paralysis in the nervous system. And how it happens is that how we detect is that we do nerve conduction studies. We do a stool test for poliovirology, first of all, which is done free at NIH. It costs 1 lakh per, more than 1 lakh per patient, but it is done for free. We have a regional lab in Pakistan which just detects polio virus in stool samples, and it basically processes all samples of Pakistan and Afghanistan. And how it attacks is that it goes from gut to the anterior horn cells, where it basically attacks our nervous system. And the third part is that how we, if we don't have the stool virology available, if it is a very old case, we do nerve conduction studies. These are done at selected specialized care hospital. This is also being done in CMH, at CMH in Kharia, where we test the nerves for the damage. And that is how we detect polio in those cases. I hope I answered your question.
Okay, thank you, madam. Now the closing ceremony. We will present Dr. Sadaf with a letter of appreciation and a certificate on behalf of Catholic Science Society and Club. I hope, madam, you have received the uh, letter of appreciation and certificate for as an acknowledgement from our coordinator, Dr. Zahid Anwar, and the president of the Catholic Science Society currently from the student body. And in addition, there is one another announcement here. Just like the Hayati Society at UoG, we are starting a society at Gujarat. It will be Razakar Equipment Society, or in short, Raza Equipment Society. The main aim will be the same, to promote the education, science and innovation at गुजरात लेवल, और उसमें हम यही सेमिनार और वर्कशॉप और एग्जीबिशंस के ज़रिए स्टार्ट करेंगे. और इस सेमिनार के वसासत से मैं डॉक्टर सदफ को भी इनवाइट करूंगा कि वो हमारी रज़ा इक्विपमेंट सोसाइटी एनजीओ में एज अ एडवाइजरी बोर्ड में वो भी हमें ज्वाइन करें. So it will be very good for our future endeavors for the of education in Gujarat. So this was all about from my side. Last closing remarks from Ms. Sadaf, and then we'll.
Thank you so much, Dr. Akash, and thank you to all the faculty members and students who have joined today. And you know that the public health is a shared endeavor. It cannot succeed just by one person or one organization or only government or only private sector. It is a private public partnership, and it involves community, and you can be effective ambassadors for health promotion in your respective spheres. You can clear up the misconceptions, and I would be honored to be in touch with you through your society and endeavors. And I'm thankful to Dr. Akash for organizing this very engaging session. And it is good for me as well to hear the student voices and the faculty voices, and to see that you are all interested in our shared health goals of health for everyone. So that is all from my side. And thank you so much, Dr. Akash, again for organizing this. And thank you for the letter of appreciation. And being working in Gujarat, it is always a pleasure to engage with the education department